Okay, so at this point, we've talked about a chemical hygiene plan, and we've mentioned some things to do and some things not to do, right? And I hate to say it, but we used the Cape Fear Community College's chemical hygiene plan as a thing to not do. This can be improved. It can be much better. It can be more full-bodied. It can be easily accessible. And currently, at this moment, when this video has been recorded, that is not what we have seen on our campus. And then we compare that to something that was to do, something that was very good. And this was Cornell's version of a chemical hygiene plan. So we saw how accessible it was. We saw how interactive it was. It was very clear. It was very organized. It was specifically for the areas that had chemical hazards associated with them, and not included into a document that just had a safety plan involved, right? An overall safety plan that really the majority of it didn't even relate to us in the first place. So these are some things to do, some things not to do, and we use those as an example. So we're going to end up with a ramp. And ramp, of course, the R stands for recognize. So we've now determined that the chemical hygiene plan, and in specifically the chemical hygiene officer, will recognize the hazards in the lab. That is why they are present. That is why they should be identified. That's why they should be used. It is this particular document and this particular person that will go around and help us as a laboratory recognize the hazards that might be present in our teaching spaces or in our laboratory facilities. The same thing would happen to an employer, right? The employer would pick one employee or a committee of employees to go around and recognize the hazards in all of the laboratory spaces. Next is assessment. Again, it is the chemical hygiene plan's responsibility and the chemical hygiene officer's responsibility to assess the hazards in the lab. What could happen to us as an employee? Those things should be identified, and those things should be described in the document and enforced by the CHO or CHO committee. M is minimize. We need to minimize the exposures. The CHO will help minimize this exposure. Their job is to go around, again, identify the hazardous chemicals. Once they have been identified, why are you using them? How are you using them? And ways to minimize the exposure to the people that have to handle them. That is why they're there. That is why they're present. That's why they're employed. And P is called prepare, right? So the chemical hygiene plan will assist someone in preparing for an emergency, and the CHO can help with this, right? If something happens and there's a spill, if something happens and a hazardous chemical gets on someone's skin, well, I can turn to the chemical hygiene plan that will tell me the steps that I need to do, maybe to go see a physician, go see a doctor to clean up the spill the proper way. And I can also contact the chemical hygiene officer. And the chemical hygiene officer will give me that information and maybe save me some time for looking up the answers to my questions that I might have, which is very important why the CHO needs to be knowledgeable in your specific areas. Sometimes one CHO representative is good enough. That's all that it will take, right? You have minimal lab space. You have just maybe a handful of laboratory experiments that go on. You don't have a lot of reagents that you've got to worry about as far as hazardous waste goes. So one CHO is probably okay in that scenario. But if you're like the campus and you have multiple labs with a variety of chemicals in each one, with different perspectives on science in each program, one person probably is not enough to kind of represent those areas and to answer those questions if someone does have a question on if something happens in the future. So keep this in mind when you get employed. Keep this in mind if you are employed right now. These are the things that should be open to you. These are things that you should receive training on. These are things that you should be knowledgeable in as an employee at the institution or at your employer at the laboratory facility that you currently work at. All right, so that's all that we need to say about chemical hygiene plans. So you've got one more assessment for this laboratory module or lecture module that has a couple of questions in it. These questions I think that you'll be able to answer very easily if you watch these videos, and good luck to you. Hopefully you'll get another 100 on this assessment, and hopefully you'll continue your A average. And I hope that you have one right now. You should, as long as you're doing the work.